Medicare Part D is an important aspect of your healthcare coverage that you need to be aware of, understand, and have in place. Medicare Part D is what's referred to as prescription drug coverage. There are two main ways that you can get your Part D plan, and it's important that you do so, as we'll discuss later. So what's the first way that you can get your Part D or prescription drug coverage? It's by getting an MAPD, also known as a Medicare Advantage prescription drug plan. If you decide to get your Part D coverage this way, you need to make sure that it is an MAPD and not just an MA or a Medicare Advantage plan, because an MA does not include the Part D coverage. And with those plans, you are not able to get a standalone prescription drug plan. So just make sure when you're looking that it's an MAPD. This way it will include the Part D in the plan, and your prescriptions will be covered. And you will also avoid the Part D penalty that we'll discuss later. The other way that you get your Part D coverage is through a standalone prescription drug plan. Now, these standalone plans are usually sold through private companies that offer these plans and products, and they work well if you decide to get a Medicare supplemental plan, since original Medicare and supplemental plans do not include drug coverage. Of course, there are multiple companies that offer prescription drug plans, and inside each one of those companies are various plans. So you want to make sure that you choose a plan that covers your current prescriptions at the lowest rate possible, as each one can cover them a little differently. So just to recap, if you're going to get a Medicare Advantage plan, make sure that it's an MAPD or a Medicare prescription drug plan. And if you're going to just go with basic Medicare or with a supplemental plan added, like Plan G or Plan N, then you'll want to make sure that you get a standalone prescription drug plan. This way you can avoid the Part D penalty. So, what is that Part D penalty? Well, Part D penalty is for individuals that did not get a prescription drug plan, and they did not have prescription drug coverage through their employer that was as good or better than the Medicare coverage. So how that works is when you initially enroll for Medicare, you have what's called your IEP, or your initial enrollment period. This is a 7-month window that allows you to sign up for this prescription drug coverage. 7 months means 3 months before the month you turn 65, the month you turn 65, and then the 3 months following the month of your 65th birthday. So during that 7 months, you can either get a Medicare Advantage prescription drug plan, or you can sign up for a Part D plan, a standalone plan. When does that penalty kick in if you don't sign up for either one of those? Well, you have up to 63 days after your initial enrollment period of 7 months. So if you do fail to enroll in one of these plans, what will happen is there's a 1% penalty per month that you do not have prescription drug coverage. And the thing is that penalty stays with you for your whole duration that you're on Medicare. So that's why it's so important that you make sure that whatever plan you choose or product you choose, that it has Part D built into it so that you can avoid that penalty. Now stay tuned for Part 2 of prescription drug coverage. What if I'm not on full Medicare? Stay tuned.